Thank you to everyone who has been able to join us today for our final Living Well Beyond Cancer presentation for 2022. The goal of this series is to provide those whose lives have been affected by cancer with the tools and resources to live well beyond your cancer. The team at ReVital want you to be able to do the things that make you, you, like going for a walk, returning to work, enjoying the holidays, cooking a meal for your family, walking around the mall, whatever it is that makes you, you. Our therapists are trained to help you identify and achieve specific goals that are important to you. It is my honor to introduce today's presenter, Jessika Wheeler. Jessika serves as the Minnesota Program Director for ReVital, Select Medical's Cancer Rehab Program. She is responsible for providing support, resources, and mentorship to a multidisciplinary team of 32 cancer rehab specialists, as well as establish and grow relationships with oncology practices to increase access to care for those experiencing a cancer diagnosis. She is also a mentor in Select Medical's Cognitive Rehabilitation Clinician Development Program. In addition to her work with ReVital, Jessika was Minnesotans champion during the initial development and rollout of the R2 COVID program. And prior to joining Select, she worked at the Rosenberg Center Pediatric Developmental and Behavioral Needs Clinic. She graduated with a master's degree from the University of North Dakota and has been interested in the role of rehab in cancer care prior to this. So welcome, Jessika. And we also have some wonderful survivors joining us and those who are currently dealing with a cancer diagnosis, and you will get to meet them shortly. After our presentation today, we're going to do a lot throughout the presentation. Actually, it's slightly different today. It's going to be a live Q&A. If you have questions for myself, Jessika, or Suzanne or Linda, please put them in the Q&A and we will be able to address them. A reminder that this material is not intended to represent methods and or procedures available for the medical condition discussed. It is only intended to present an approach, a view, a statement, or an opinion of the presenter, which may be helpful or of interest to patients, caregivers, or practitioners. Under no circumstances is the information provided to serve as medical advice. Before we close, we'll review topics for the following year. So without further ado, I am going to introduce Jessika Wheeler, and I'm also going to introduce our survivor, Linda Green and Suzanne Reynolds. So first, we're going to do a little intro. 3 minutes or less. I would love, Linda, if you could start us off and just tell us a little about how you ended up joining us today.
Yes, good afternoon, everyone. My name is Linda Green. I live in Roselle Park in New Jersey. I was an elementary music teacher for 32 years and retired 7 years ago. And I am sort of currently working at Kane University in the music education department, but I had to take a year's leave of absence from doing that. My journey started only in the end of June, where I had severe pain in my back between my shoulder blades. And I went to the emergency room with my husband, and they were very concerned. They performed a CAT scan on me, and they found a tumor that was wrapped around my spinal cord and the vertebrae. I was admitted to the oncology unit of the hospital. The next morning, they were giving me morphine, and I went numb from my armpits down. I could not move anything. So I said to the nurse, "Don't give me any more morphine. I'm numb. I can't move anything except my arms and my head, obviously." And she didn't say much, but very soon the doctor from neurology came and asked me if I could move anything, and I couldn't. So I I was rushed into surgery. I had 9 hours of surgery where they removed most of the tumor. There was still some left that they couldn't get at through surgery, but I was able to move a foot when I woke up after the 9 hours. I did get a little PT in the 12 days that I was in the hospital. I had 7 different scans. I had a bone marrow biopsy. They were wondering where this tumor started. They hadn't diagnosed it as yet, although I'm sure they knew what it was. After my 12 days in the hospital, they asked me where I wanted to go for therapy because I had to learn how to walk again. And I specifically asked for Kessler. And I had a friend who was there and had visited her during one of her therapy sessions. So I was fortunate enough to get to Kessler. And I was there for 2 weeks. And I had 3 hours of therapy a day, which was amazing. We had an hour and a half in the morning, an hour and a half at night. I had physical therapy, I had occupational therapy and group therapy, and all 3 were wonderful. I was introduced to the ReVital program by my occupational therapist, and it was recommended that when I went home, I would continue, and I have been continuing ever since. They taught me how to walk again. I went home with a walker and a cane. But within about 4 weeks, I did not need the cane or the walker anymore. So I am walking.
Your story is so remarkable, and I really look forward to hearing further about it. I'd love if we could also bring in Suzanne. Suzanne, if you could give us a little quick who you are and what makes you you and how you ended up on this webinar today.
Good afternoon. Hi, my name is Suzanne Reynolds. I am a 65-year-old registered nurse, was working for 44 years. I was diagnosed with triple negative breast cancer in 2014. I had a total left mastectomy with a fat graft and 3 reconstructive surgeries. I had chemo, I had Taxotere and Cytoxin, and I did fairly well with the treatment and with my surgeries. I had 3 reconstructive surgeries. I had the tissue expander put in after the total left mastectomy. Then I had the fat graft and the implant, a permanent implant put in. And then I had a right breast lift 9 months later. So my reconstruction was complete. I went back to work. Everything was going well. Cancer-free. Fast forward to July of 2021. And with my routine breast MRI, they saw fluid accumulating behind the implant. And I had to have, June of 2021, I had to have the implant removed. And I proceeded to have a right free tram surgery, which they took a core muscle from my right lower quadrant of my abdomen and moved it to my left breast. And the surgery was not completely successful. They had to remove about half of the graft. It didn't all take it, rejected. I was developing an infection. I had a huge hematoma, and I had to have half of it removed. So I had a 15-inch incision across my abdomen, and then 2 incisions in the left breast with a huge infection. I came home very weak and deconditioned, to say the least, and in excruciating pain. And my surgeon recommended that I go see Dr. Stubblefield up at the Kessler headquarters up in West Orange. Luckily, I live in New Jersey. And that was where I got introduced to the ReVital Cancer Care Program. And they set me up with an incredible group of occupational and physical therapists. And I had therapy like I had never had before in my life, soft tissue massage, occupational, upper, lower body, everything. And I have to say, Kessler saved my life, because I didn't think I was going to make it after that surgery. The pain was so excruciating. My mobility was completely shot. The abdomen was just numb, and it was just a terrible situation I was in. I'm like, how am I going to ever get through that? But Kessler got me through it. And it's been over, let's see, it's been June, July, August, it's been 16 months, 17 months now. And I'm doing really well, full mobility back.
You
but,
look, I mean,
it
just
took a lot of work though. It took a lot of work.
I know. And I appreciate both Suzanne and Linda for being willing to share their stories with us today. I think they're both, as we're all very unique, but their stories have some twists and turns, and they're at different stages in it. And I think the purpose of today is really if Jessika and Suzanne and Linda can impart a little wisdom and ideas on how we can survive, and not just survive, but thrive during the holiday period. December is so busy for everyone involved. And without dealing with a cancer diagnosis or recovery, it can be a stressful time. So to start up with, the first tip that we're going to ask Jessika to talk to a little about for us is going to be time management. How do we get it all done, Jessika, in the month of December?
Well, Kirsty, I mean, I feel like that's such a loaded topic in the first place.
I really loaded that. Sorry.
even during good times, right?
Yeah.
Well, and so that's what I want to speak to again today. So, hi everyone, it's good to see you all again. For those returning to Living Well Beyond Cancer during the holidays, welcome back. A lot of these concepts are going to seem familiar. But as Zig Ziglar once said, that repetition is the mother of learning and the father of action. So if you're new and hearing this for the first time, or if you've heard this before, I hope you learn something and are able to put even just one thing into action this holiday or for your next upcoming event. Okay. So this year, I want to start the presentation off by asking you to keep in mind two words as we go through this: meaning and purpose. Write them down on a sticky note, type them out on a sticky note on your computer, or just hold them in your brain. They're gonna come back. All right. So like I said, holidays or other special events can be really fun and so full of joy. But like I was talking to Kirsty, like even in regular life, they come with high expectations, lots of stress, cooking special foods, hosting bigger parties, buying gifts. And now that balance of navigating the holidays can be even further complicated by being at various stages of cancer treatment and survivorship, as well as your own emotional understanding of the journey that you're on right now that you didn't sign up for, right? So that's why I want to take this opportunity to share some ideas about how to use your time and energy during these moments in a way that sets you up for success, so you can enjoy yourself and these events without feeling like you have to sequester yourself for the next 2 months to recover, all right? So I want this presentation to help during the obvious upcoming December holidays, but really these are tools that I teach patients year round that are good to remember for Easter, Ramadan, Hanukkah, Navaratri, like weddings, graduations, 4th of July, Kwanzaa. I mean, the list goes on, right? Any time of high expectation and extra activities, remembering the meaning and purpose of what you're celebrating, and remember that it's okay to do what you can with what you have. So like what Kirsty said, first to start, I want to talk about time management because it's the first step in kind of my encouragement to you all to acknowledge or to encourage you all to self-assess how much energy you have, what you have to do or what's on your calendar, and what kind of plan you can make to take care of both yourself and your to-do list and celebrate, right? So time management, we're always where I like to start. It's an elusive creature, time management, right? This is one of the biggest stressors for people, even on a good day, myself included. So much to do and so little time to do it. And holidays and events always feel like they sneak up on me. So my first recommendation that a lot of these other concepts build off of is to have some kind of visual calendar. Could be on your phone, a paper calendar, a single calendar sheet for the month that you can easily print from the internet, or whatever speaks to you, right? A whiteboard calendar is what I use too. But put up a calendar for everyone in your house to see, where you have one space where all your events and activities can be found. Seeing the timeline and how things kind of fit together in the puzzle piece, right? Gives you a chance to plan preparations and tasks around each other so you don't wear yourself out. Like I said, I mentioned preparation. By seeing just how much time until events, you're able to start preparing a few days or even weeks in advance as needed or as able. trying to space out activities and some of your necessary, like normal to-do items, like cleaning the house or walking the dog or whatever. So they don't all have to get done in one day or pile up towards the end of the week, right? Now, like I said, if you're anything like me, you get really easily sidetracked, right? And wrapped up in a task, which usually throws off the entire rest of my well-intentioned schedule. So always check out using alarms and timers on your phone clock, or even like the little old-fashioned like twist timers, to make sure you don't get sucked into a time warp and spend 5 hours like wrapping gifts for 2 weeks from now, when you have like a big family gathering tomorrow where you can start pre-peeling the potatoes to save your energy, right, for the next day. Another benefit of having a visual calendar and mapping out time in the context of being on a cancer journey is you give yourself a chance to plan around treatments and set realistic expectations. So like hosting a big family meal 2 days after chemo might not be great. So offer to reschedule events for when you usually start to feel better, or even before chemo might be a helpful modification. And having a delayed holiday until a few weeks after radiation is done, or scheduling a celebration early before surgery, are all possible opportunities to keep meaningful celebrations on that calendar.
So I'm going to go ahead and ask Suzanne. Suzanne, are you? How do you manage time? Do you use a calendar on a routine basis to get everything done in your busy life?
Absolutely. I have a paper day planner. I am old school, but I have that with me all the time. And I have done that for years.
So you were set up to succeed. Yes. Right. Linda, are you a paper planner sort of person, or are you a put it all in your phone?
No, I'm a paper planner, just like Suzanne. I think it's our age, Suzanne. I've done it for years as well, but it has been really helpful because I'm dealing right now with coming up about 6 doctor visits.
Right.
I'm off my chemo. By the way, I have multiple myeloma. I didn't get that in. I'm sorry. I've gone through radiation. I've gone through 3 cycles of chemo, and I'm ready for the transplant. Fortunately, I got it after the big holidays, and it starts on December the 28th. I was very fortunate that the doctor allowed me to do that. But I have all these visits. I have, the different other events.
They're hugely important appointments, right?
Oh yes. Like yeah. I have to get these in.
Right.
So for example, my Christmas decorations are now up. So instead of taking 4 days to put them up, it is taking me about a week and a half, but that's okay because right. I started early.
Yeah.
But yes.
Right. So you planned that one out, just almost like Jessika had told you to do it. The next tip we're going to have Jessika, we sort of segue into this one, actually. We're going to have Jessika sort of speak to energy conservation, which is a little bit of what Linda was alluding to then as well.
Yeah, it's almost like we planted her, like she knew what she was talking about. But this next one, like Christy was saying, energy conservation is a huge part of my practice as well. Whether we're talking about cancer-related fatigue or any kind of complex chronic fatigue, as well as, like you said, just planning ahead. I think these are important rules for anybody to live by, let alone people at various stages of the cancer journey. So now we all have our visual calendars, right? You've got your time laid out. So now energy management is going to kind of inform how we're going to use that time, right? Decorating, cooking special foods, traveling are all super fun things, right? But they take energy. Our daily lives can make us tired, and now we have to do even more for the holidays, and we got to be happy about it and do it with a smile on our face, right? So energy conservation strategies are ways that we can adapt the way you carry out those activities, or help you assess and adapt the environment where you do the activities. This way you can do what you need to do and still have a chance to do what you want to do, right? Now, there's multiple elements of energy conservation that I teach patients. And there's arguably way more than just 4 Ps in energy conservation, but I just wanted to focus on these 4 today. So plan, make a plan and space out preparations into stages, exactly like what Linda was talking about. Shopping for an hour at a time, right? Not doing the 3-hour Costco run, right? Or decorating for 30 minutes before taking a rest, using those timers that I talked about. Setting realistic goals and timelines, accounting for your symptoms if you're on active treatment, right? Making a plan. Then prioritizing. Make sure you get your day-to-day tasks done, because those can pile up and add just as much stress too. And then maybe make a list of your absolute must-haves for like how you're going to want to decorate or the foods you want to make, to budget some time and energy for them so that we can keep the holiday or the event special and meaningful to you and your family. Next one is P for pace. Give yourself enough time to get something done. Listening to your body. All right. You are the master of your own body. You know what's best. And it's easier to keep fatigue managed by regular rest breaks than trying to pick up the pieces after you've used all your energy. Right. And then the last P is position. Even completing tasks while seated, remembering good posture for breathing mechanics, can all reduce the energy it takes to complete a task. And then another wonderful yet surprising tiring element of the holidays or special events is socializing, right? So humans are innately social creatures. There's no denying it. So I still want to make sure that we take the time to honor this and celebrate it this holiday or during other special events. So I want to make sure you guys find ways to still engage and interact with family and friends. Quick tips for modifying or being mindful as we talk about managing energy for hanging out with loved ones are to set boundaries. Things you are and aren't willing or able to do. Cooking, planning and organizing, traveling over 2 hours in a car or hopping on an airplane. While a reminder of how things are different right now, setting boundaries like this is really important. And Linda said it first, it's completely okay to take a week to decorate, not 4 days. It is okay. Planning ahead, make sure you allow the time you need to prepare, right? You need some time to bounce back and assess your energy and needs after event. Plan ahead for both the pre and the post activity needs you might have, okay? Creature comfort. Make sure you feel comfortable and confident in your spaces when you're going out to parties, because having scoping out and seeing where the bathrooms are and having those nearby and accessible when you're balancing constipation and diarrhea from chemo, or having a quiet space to escape to so you can take a break, are super essential. And always remember that being around others can be both energizing as well as draining, right? Busy social environments can overwhelm our introverted friends, and extroverts get really wrapped up in celebration just to crash after. So remember to check in with yourself and see what you need. When in doubt, just plan smaller gatherings with a few people in a controlled, familiar environment, because those smaller events, while different, can be just as meaningful and fabulous as a giant family bash.
Very, I think, helpful tips for everyone, Jessika. I'm going to go ahead and ask Suzanne how you are going to be employing some energy conservation during the holidays in your home.
Well, I have found deep breathing and meditation to be essential in my life, because I tend to get very hyper. And if I feel good, I'll just go. But since I have had this surgery, I have really learned to conserve energy and to just kind of take a time out. When things are getting too crazy, I'm like, I'll be doing something and I'll just say, okay, wait a minute. I need to take a pause. I need to breathe and just, see where I'm at. Okay, what is the most important thing that I need to get done now? And to not get so far ahead of myself, because then you begin to get overwhelmed because it's too many things. So trying to do that. The other thing that I found is a huge time saver with shopping, and especially if you're in treatment and you don't want to be in stores around people. I mean, Amazon, really. You just order your stuff and it's there the next day. It's so great. I just got 2 things this morning that I ordered because I was, looking for, a few gifts. So huge time saver, I have found.
Time saver, rather than wandering aimlessly around a mall with everyone else. You can also, and my husband may or may not hate to do the groceries, so he even is trying to encourage me to use Instacart for the weekly grocery shopping, which is another way. One thing I like to talk about energy conservation is you have one gas tank. How do you want to use that gas? And if you burn your gas by 10 a.m., that's a long day, correct? Linda, I'm going to ask you, given that you are in active treatment, how are you approaching getting together and using your energy as you would like this holiday season?
Yeah, I'm fortunate because my husband doesn't mind shopping. So a lot of the groceries he can do. th- um, I do things like, okay, depending when, I'm just giving an example. Monday, I'm going to just make sure the bathroom is fairly clean. All right. Tuesday, I'm going to make sure the kitchen is fairly clean. So I kind of, I would have done it all in one day, and I can't do that anymore. So the cleaning aspect will be, one thing per day. I don't have a big house, so it's not, ridiculous. The other thing is that, as far as the cooking goes, I only cook a few things, and my family all bring. We've always done it that way, so it's nothing new. We all bring a dish. So I plan it all out. I write it all down. I make lists. I think we're going to have about 12 of us this Christmas. And I will assign, please bring a vegetable, please bring this, please bring the other thing. And as we've always done it, it's not anything different. The other thing is, on the day, they're all willing to help. And I have to be a little more careful about letting them help, and that's okay. But if I am overwhelmed, I say I have to go on my recliner and just rest. And they all know what I'm going through, so I don't have to worry about that. They're all fine. They would rather I do that than,
Right.
they would rather help.
Right. And just to what I've met of you, Linda, in preparing for this, it's letting people help us, correct? Because it seems
Yes.
like you could do it all almost. But yeah, if you let people help, usually they really are wanting to help, correct?
Absolutely.
Yeah.
And it was a hard, I also had, when I first was diagnosed, I had ladies come over while I was in the hospital, and they cleaned at least my bathroom and my kitchen. And it was hard for me to accept that. In some ways, I was like, oh my goodness. But I've learned to accept it. And I've also learned that the ladies want to help, and they're happy to help.
Right. Right.
It gives them an opportunity of service.
Agreed. Absolutely. And again, I think energy conservation is really thinking about meaning and purpose. I believe for Jessica's 2 words, what's important to you and how do you want to use that any time of the year, but especially during this busy season. So Jessica, how are you doing?
Yeah, I was gonna say, anytime we get into these like quiet family gatherings, right? We always get, how many people get this question? So how are you doing? Like they almost like they corner you, right? It's well-intentioned, right? How many times do people are people coming up to you that you haven't seen in a while and asking to hear about your cancer, or they haven't heard more about your cancer journey, and they're going to ask how treatment's going, or they want to share, like I said, well-intentioned advice about someone else's experience with cancer, or something that you could try to make you feel better, right? Like we were saying earlier, most people, like, they want to help, right? But a lot of people don't know how to navigate these conversations, but they know they just want to be there to try and support you, right? So I want to take a moment here to give everyone a little gentle reminder, or permission, whatever you need, that you don't have to tell everyone everything. Sometimes it might feel good to talk about it. Sometimes it might be too much. If you want to talk about it with someone who's asked, but it feels like at the wrong time, offer to call them or meet up another time, right? Or if it's a person you really don't want to go into too much detail with, it's okay to just give them like a quick generic summary and then guide the conversation into a different direction. So one thing that I encourage my patients to kind of do before like the family wedding coming up during the summers, or especially, like I said, with like the holidays coming up, prepare an elevator speech, right? This comes from the world of kind of marketing and interviews and things like that, but it works really well for the cancer survivor too, because what it is, essentially, if you're not familiar, it's a 1 minute or less response that you're supposed to be able to deliver in an elevator ride, right? So it's a short summary of where you can include as much or as little detail as you want. So I really encourage everyone to write out a response, practice it if you need to, but it still doesn't mean you have to walk people through your whole journey, like to date, right? Your treatments, your side effects are all up to you to share, right? And if you want to. So if you want to talk to someone more, set up a time to connect or find a quiet spot where you can actually talk about it more. And like I said, remember, it's your journey, not anyone else's, because it can get really easy to compare or get wrapped up in the moment. And so do what feels right for you. What I always encourage my patients to do.
Yeah. I think that's a really great advice, Jessika. Suzanne, do you have a quick answer that you typically give when people ask, how are you, or what sort of cancer you have? How do you approach these questions?
I just tell them really quickly what happened to me, and I don't go into too much detail because right now I'm doing fine. So, I just say I'm cancer free, and, I went through all the treatments, and I've had, several surgeries and treatment, but at this moment I am cancer free. So,
Which
and
is fabulous.
yeah, and people usually congratulate you, which I always find an interesting thing. But I mean, it's very nice, but I don't know. I find it,
Yeah,
I don't know. I have to chuckle a little when
it's
people
another.
see.
It's
fine. It's fine.
well-intentioned, correct,
Yes.
Suzanne? It's another well-intentioned one. I know that. Linda, so, you're actually dealing with treatment at the moment. Have you thought about how you might answer some of these questions coming up to the holidays?
Two things I want to say. First of all, it really depends, as you say, on the situation and the person.
Right.
I don't mind being fairly detailed if they want to hear, but I also feel, though, why should the whole conversation be about me? And I like this, well, what's new with you? Because I always say, okay, that's enough about me. How are you doing? And I think because people do like to talk about themselves. I mean, let's face it. But I am interested in how they're doing, and I want them to know that.
Right. And you need, I think that's a really good point, because sometimes they're like, tell me what's going on with you, and you share it all. And there's this empty space where it's like, well, what do we say now?
Yes. Yeah. I want to be cheerful about it. I don't want people feeling sorry for me. I know people do, but I don't really want that. I want them to know that, with my faith, and we'll talk about that later, but, I'm doing well. Considering all I'm gone through, I'm doing very well. And I want people to know that.
Yeah.
And the attitude and the good attitude that you have, I think makes them feel more comfortable.
Right. Because especially, depending on what your story is, sometimes when you share how you're doing, it's some pretty tough stuff that people, and so then people are left with, you might have worked through that, but then you're leaving that with people. So it can be a hard conversation. I love the quickly. So do you move them off topic pretty quickly, Linda? As soon as you say, how are you? They're like, oh yeah, well, I'm great. And they move on.
Yeah. I mean, I haven't had any difficult conversations so far.
Yeah.
As you say, you have to know who you're talking to, and what you're comfortable sharing. But then I really want it to progress to be a normal conversation. So I always was like, how are they doing, or what are they doing right now? I ask questions about them.
Right.
So that it's a two-way conversation, not just me saying.
Not just you sharing. Yeah. I think that's fabulous advice. Okay, I think we've talked about how to navigate questions, and I 100%, because I even do this with my children, agree with Jessika. Practice it, people, and you don't have to share anything. So be comfortable with what you do share, and if you practice it, it'll get very natural. Now we're going to talk about some of the fabulous things about the holiday season, which is traditions. And I'm Australian with an English background as well. So my traditions are all very different to these American traditions. So I will let Jessika lead us into this one.
Well, traditions, I mean, no matter where they come from, right? They're all fun, they're all beautiful, and they all deserve to have their moment in the sun. So one thing, I guess, so for me, I'm not Australian or English background, but I am a musical theater fan. And for anyone out there who's seen Fiddler on the Roof, one of the opening numbers is where Rectavia sings about tradition, right? And he goes into great detail through the rest of the song about what each member of the family and the community do to uphold tradition, right? So when I open the site, that always just makes me think about that, because it highlights right away what are our roles and our habits and our routines that we do that make up tradition and our cultural practices. So within your own homes, I want you guys all to find some ways to still keep tradition. Just modify it if you need to. So explore the beauty that is semi-homemade cooking. Cut some corners, make some baked potatoes instead of mashed. Use some store-bought components or dishes. Remember that frozen pie crust, instant matzo ball soup, store-bought rotisserie chickens, stovetop stuffing, grocery store catering, they all exist, and they can save you valuable time and energy to spend doing something else, or gas, right? In Kirsty's analogy, they can save you gas from your gas tank. Like what Linda was saying, if you're hosting, request a shared meal or potluck style. So that way everyone brings a dish. You can pick out what's realistic and enjoyable for you to cook, and then delegate everything else. Another one that, I mean, I think Linda, you said it too, like it's how do you like transition and make it like keep it lighthearted, right? And so I think that can also transfer into just the overall celebrations that we're choosing to have, right? These are weird times. So feel free to everyone just have a weird meal, because then everyone's going to be able to look back and laugh at that one 4th of July where you just bought KFC, right? Instead of standing at the grill for hours, or buying a rotisserie chicken for Thanksgiving instead of having a turkey, right? It's a funny little kind of capture in time to make a step back and realize like, oh, this isn't normal. It's kind of funky. It's new. It's different. For decorations, ask some help from family or friends or community groups. I know like some Boy Scout groups or church groups have been known to go in and help decorate houses or Christmas trees. Pick just a few of your like meaningful decorations and display those, right? Maybe plan a drive to go see some other decorations or lights or things that make you feel warm and festive. So that way you can still enjoy the season without having to do as much setup and takedown in your own life. And lastly, just remember the importance of connection. Using this as an opportunity to teach someone else how to cook your dish, right? Invite a friend over to be the runner to pass out Halloween candy so you can lounge in the chair, right? Or have someone else host this year so a version of the tradition is still present and meaningful. And then lastly, I guess I encourage everyone just consult your cultural and spiritual leaders, right? These faith leaders and community leaders really like oftentimes can offer great alternatives to some of the traditions and practices that might impact your energy and symptoms, but are really big cornerstones of your faith, right? They might have tips and tricks that others from the community or from the church have shared with them that you can implement, or offer something else you can do instead, as well as offer you prayers and blessings or well wishes.
I love those suggestions. Suzanne, taking on from what Jessika was just saying, is there any sort of recipe or anything that you have passed on this holiday season, maybe cooking or getting the house ready to give you a little more gas in your tank?
Well, currently I'm doing well. So not this season, but I do have a story about when I had just finished treatment. My hair was just about coming in, and I went back to work. And as a nurse, I was working in the hospital. I was working long, long hours. I was just exhausted. And I said to my husband, I said, there's just no way that we can do a Christmas tree this year. And, you know, he just kind of felt bad about it, because that's kind of my thing, you know, that I like to do. And I just didn't have the energy or the time. And I came home from work, because I'd always get home and it was dark, and we have a telescope in our window. And he went ahead and put lights all on the telescope. And when I pulled up in front of the house, all these lights were on the telescope, and it looked so beautiful. And he put a big bow on it, and that was our tree. And that is just a great memory, because he really did that from the heart.
Yeah,
Because he just knew it was going to be too much for me to have a tree too, and I'd be wanting to do all this stuff, and it was just too much. So that was, you know, in past years. So there are other things that you know, you could break from tradition for the one year that you're just not up to it. And that's okay.
Yeah. Here's my question. Do you still decorate your telescope?
No.
Because I probably would.
Yeah, it did look really pretty. No, we've been getting
You've
a
been
tree
getting
ever
your
since.
tree.
Yeah, we said, you know what, we're gonna do a tree for as long as we can.
Yeah. But I love that.
And
And I think that's just a perfect, or you can buy little pre-made trees. There are so many.
there's so many
different-
options.
Yeah.
Absolutely, yes.
Yeah.
So, but no, I do the cookies. I don't do as many as I used to. I used to do so many varieties. So I've just cut down to a few varieties now.
Suzanne, what's your cookie specialty?
Oh, I make these Danish spritz cookies that were my grandmother's recipe.
Oh, they sound
With the
so
cookie
good.
press.
Yeah.
And I had to I had to get used cookie presses because they really don't make them anymore. The hand ones where
Yeah.
you crank it, and to get that spritzy look, those are really special. And ginger cookies too
Yeah.
are good. And chocolate chip, of course. My husband only likes 2 chip in each cookie.
Oh,
He
wow.
doesn't like them too chocolatey. So I just do two chips.
I have never heard of such things, but Linda, faith
Yeah.
is a big part of many of our lives, and I know it's a big part of your life. How do you incorporate faith into your journey, and is it part of your traditions at this time of year?
Oh, my faith, as I told somebody at the Institute, I said, it was my faith in God, prayer, and Kessler. I feel I've been, it's like 100% of each. And I will continue to rave about Kessler. But my faith in Christ has been part of my life since I was 10, at least. The church has just rallied around me, not just my church, but a lot of sister churches. And there's a group of orphans in India who, one of our gals is a missionary there. And in England, of course, because I'm from England, I still have my sister there and other relatives, and they're all praying for me all over. I cannot tell you how much prayer has meant to me. When I'm lying in bed and my back hurts, in fact, it happened last night, and I couldn't sleep, and I'm going, Lord, could you please take this pain away so I can get a couple hours sleep? And you know what? I woke up at 7 o'clock and God had given me, a good 4 hours sleep. And that's happened over and over and over again. So my faith is huge. It is, I don't know what I would have done without it. And I have been very blessed. And and the other thing is my family, and especially my husband. He's helped me put the decorations up this year. Usually I'm like, I'm doing it. It's all me. But he's been so helpful in helping me with the decorations. So I have a lot to be thankful for. And yes, thank you for letting me answer that question. Appreciate it.
You're welcome. And just the thought of people all over the world putting you in their hearts and wishing you well is just really, I think, what the spirit of this season is about, isn't it?
Yeah. It's exciting to think about it, actually. And I what I would like to learn is, how can I give back that incoming of prayer and love? I want to give that back to others.
Yeah. Well, again, having met you a couple of times now, I have no doubt that you will be doing that, Linda. For those that are watching us, if you have any questions, please put them in the chat box now. Otherwise, we're going to start to wrap up today's wonderful discussion about holidays and traditions and enjoying this busy time of year. While we're waiting for any last questions, I would like to say a huge thank you to Linda and Suzanne. I think it's really brave of you to share your stories and to be willing to share them on this platform. And of course, a big thank you to Jessika And I am going to let her do her final slide because I just would not do this justice. So Jessica, if you want to jump off mute and remind people.
Always here for reminders, Kirsty. So here on this slide, you guys can see Shakespeare is asking us to do or not to do regarding what we're going to do to navigate the holidays. And there are a few options on how to answer this, right? It's do it all, do none of it, a couple big things or more small things. Ultimately, I think what we learned today, and I loved how both of you, Linda and Suzanne, were both saying it's okay. There's no right or wrong answer. Different events, different times will all make us answer differently. So really do whatever makes sense for you and brings you joy. And I know the two words were dropped a couple of times throughout the presentation, but in case you forgot, those two words I asked you to remember: purpose and meaning. I felt really smart this year because I read a really powerful book by an Austrian psychiatrist. It's called Man's Search for Meaning by Viktor Frankl. And one quote stood out to me from that book, and it was that life is never made unbearable by circumstances, but only by lack of meaning and purpose. And I know that in an ideal world, cancer would not be a factor in your events and holidays, making you map out your activities or change your plans or pass on normal traditions. But I really hope you learned some tools today that remind you that even though circumstances might look different, there's still an abundance of meaning and purpose to find in these times as well. And even if cancer is not a part of the conversation, I would still encourage everyone to think strongly about what you do and don't do to celebrate something. Feeling compelled or pressured to host a big family dinner or travel halfway across the country to put up putting up every piece of holiday decoration doesn't make something special. That only comes from using this time to reflect, or using time to reflect on the real purpose of why we are celebrating and the meaning behind it. Ultimately, you all know what's best and what's realistic and what's meaningful for you and your family. So yeah, those are my final words on that.
I think that's a really perfect place to finish. Again, a huge thank you to Jessica, Linda, and Suzanne. A recording of this presentation will be available on our website in the coming weeks. If you want to share it or you weren't able to stay for the entire thing today. This is it for 2022, but we will be back in 2023 with Living Well Beyond Cancer. Our first presentation of next year will be February 7th. And it's going to be an Ask Us Anything About Cancer Rehab, hosted by myself and Dr. Michael Stubblefield, who we all know and brings a huge amount of knowledge and expertise to that discussion. You will be able to submit those questions via social media or email, so keep an eye out for those. You'll get an email about it if you're on today's presentation. You can register or watch any of the past presentations at our website, which is ReVitalCancerRehab.com. For those of you who are not web savvy, you can call 844-473-8485 to speak with a ReVital therapist directly and find out if cancer rehab is right for you. Follow us on social, get those questions in for next year. We hope you enjoyed today's presentation and you have a peaceful and safe holiday season and new year. Thank you, everyone who was able to join us.